Hi guys, Heather here. So I'm sitting in report one day and the night nurse tells me that the patient's in reverse isolation, and I'm thinking, reverse isolation? What the heck is that? Well, it's also known as neutropenic precautions, and when we go into the patient's room we have to wear a gown and gloves because the patient has a low white count, which makes them more susceptible to infection, and they can get this from certain diseases or from chemotherapy. So we gown up to protect the patient and prevent germs being spread to them. This seems to be the friendliest of isolations. Now, one of the least friendliest of isolations is C. diff, and this is a hard topic to talk about. I hope none of you are eating right now, because if you are, proceed with caution. C. diff is a bacteria in the gut, and sometimes patients will get this if they're on a lot of antibiotics, because the antibiotics will kill the good bacteria in the gut too. The patient's stool will have a very distinct smell, and if they have flowers in the room, you'll notice them wilting. Seriously, it's hard to be around sometimes, I'm not gonna lie, but luckily my nose isn't too sensitive. Speaking of noses and sensitivity, I have a friend who says that when I eat garlic, she can smell it coming out of my pores. I've never smelled garlic coming out of my pores before, or anyone else's, so I have no idea what she's talking about. But I like the smell of garlic, and onions for that matter. Onion breath wouldn't bother me one bit, but C. diff sure does. And I don't want to get too graphic, but it's kind of liquidy and the patient has to go every hour. The drug of choice for this situation is Flagyl. Gown and gloves are required when going into this patient's room, unless you possibly want to pick up this bug yourself. And you have to wash with soap and water before you leave the patient's room, and not use the hand sanitizer gel, although you can use the hand sanitizer gel in other types of isolation rooms. One time a nurse's aide had told me that a GI doctor that worked there would ask her and the other nurses if a patient had C. diff based on the consistency and the smell, because it's so potent. And if they said yes, he would order antibiotics without testing it in the lab. I actually sent a specimen down to lab one time to test it for C. diff, and I was thinking, this can't be C. diff, it doesn't even have an odor. But it actually tested positive. I thought that was really strange. And lastly, we have BRE. I haven't taken care of very many patients with BRE, but I've heard that to test it, you swab the rectum. So who wants to be tested? There are a few drugs to treat this, but the big one is daptomycin. Obviously no Vanco since it's resistant. And these patients have to be in isolation too, so wear your yellow gown and gloves with pride to make sure you and your patients are safe. Well guys, thanks for watching. I'll talk to you soon, okay? Bye.